A new study from the CDC has found fewer people in rural America are getting cancer, but still more of them are dying because of it. Valley News Team's Ryan Laughlin digs into what's causing higher cancer death rates and how North Dakota stacks up nationally.
People from Roseau to Rolla, actually more than 800 of them came here to the Altru Cancer Center last year for treatment. A new report from the CDC says there's a gap in how cancer patients are being treated. More of them are dying in rural America.
The challenge is the vast area, North Dakota and Minnesota are big.
As treatment gets better, fewer people are dying from cancer. The death rate is dropping, but it's dropping slower in rural America.
Access to care is one of the reasons why that might account for that statistic.
The Center for Disease Control and Prevention found in a new study the nationwide cancer death rate dropped 1.6% in urban America, but in rural America it only dropped by 1%.
There's also a need for frequent doctor visits, and a lot of patients won't be able to drive.
In North Dakota, the disparity between rural and urban rates isn't as dramatic as the nation's, but there's several reasons healthcare professionals are wary of the future.
Right now, screenings, even if you go in for a visit right now, they're covered at 100%. That's under the Affordable Care Act.
With Obamacare facing repeal and replace, covered screenings are in limbo, but that's not all.
Tobacco-related cancers are still very prevalent.
At Altru, after breast cancer, lung cancer is the most common. Just recently, the North Dakota legislators voted to pull funding from Breathe ND, the state's tobacco prevention program. The CDC says preventing tobacco usage and increasing screenings will go a long way to help rural America beat cancer.
Definitely cost-effective to prevent cancer than to treat cancer.
Something healthcare professionals hope lawmakers will keep in mind. From Grand Forks, Ryan Laughlin, Valley News Live.
According to the CDC, North Dakota ranks 35th highest for cancer rates in the nation, while Minnesota is ranked at 16.